Hi guys, welcome back to my channel. Sorry if it's a little dark because my ring light is broken, so I have to get another ring light, and I'm trying to do this video before the sun completely goes down. So today is Medicare Part B. So I'm trying to get this video done and out. Why? Because it is the season for people to enroll in Medicare Part A, B, C, and D, starting in next week on October the 15th. We're preparing at United Healthcare at this very moment. Every company right about now is preparing for the influx of calls starting next week for enrollment. So today is specifically talking about Medicare Part B. So we're not going to waste any time before the sun goes down and you can't see me. So let's get right into it. Again, this is Medicare Part B. Let's go. Okay, so the first question is, what is Medicare Part B? So again, Medicare have 4 parts: A, B, C, and D. So we've covered D, we've covered C. Now we're on to B, and B is your medical insurance. So when people enroll in Medicare Part A, B, and C, and D, they all think one is going to cover everything. No, they're individual parts to your Medicare, and your Medicare Part B is your medical insurance, okay? So I'm going to officially read you what it says, all right? It says Medicare is a federal health insurance program for those of 65 and older and other specific groups. It consists of several parts, which of one is Medicare Part B, as in boy. Medicare Part B is part of the Medicare that provides medical insurance. You can use it to cover various outpatient services. I'll get to that in a moment, okay? So what is Medicare Part B and what does it cover? Along with Medicare Part A, Part B makes up what's called Original Medicare. So Original Medicare consists of Medicare Part A and B together. That's Original Medicare. Medicare Part A is hospital. We'll talk about that in the last video. This is Medicare Part B, which is your medical insurance. Part B covers a wide variety of Medicare necessity outpatient services. A service is determined medically necessary if it is needed to effectively diagnose or treat a health condition. Some examples of services covered by Part B, and I will have them right here: emergency ambulance transportation, chemo, durable medical equipment like your wheelchairs, walkers, oxygen, equipment like that. It's covered all in your Medicare Part B. Emergency room care, kidney dialysis, laboratory testing, blood tests, urinalysis, occupational therapy, imaging tests, echocardiograms, outpatient hospital and health care, physical therapy, and transplants. Those are all covered under your Medicare Part B. Part B also covers some preventative services as well. So, and bone density measurements, cancer screening like breast, colorectal, prostate cancer, cardiovascular disease screening, diabetes screening, screening for Hep B, C, and HIV, sexually transmitted infections, vaccinations for flu, hepatitis B, pneumococcal disease. I hope I pronounced that right. So all those fall under your Medicare Part B, okay? So again, it is considered Original Medicare along with Medicare Part A, right? You have to be 65 and older to be eligible for Medicare Part B. It is your medical insurance. Not along with your medical insurance, it covers a lot of other things that fall under your medical, and we have listed those already. So we're going to move on to costs. Okay, before I move on to costs, this is very important. It said the services that are not covered by Part B. There are some services that aren't covered by Part B, and those are your routine physical exams, prescription drugs, of course, that's covered under your Part D, dental care, that's covered under your Part C, vision, eyeglass, hearing aids, that's covered under your Part C, long-term care, cosmetic surgery, alternative health services like acupuncture and massage is covered in your Part C as well. If you like prescription drug coverage, you can purchase a Medicare Part D plan individually. Okay, so those are services that is not covered under your Part B. So now let's move on to cost. So I get asked this all the time, do Medicare Part B have a cost? And yes, it does. It has a premium that you have to pay for your Medicare Part B. And that could come directly out of your Social Security check. The amount that you have to pay for your premium might change for the year of 2022, but for the year of 2021, the premium was $148.50 that come directly out of your Social Security check. It can alternate if you're a married couple, or if you made a certain amount of money throughout the year. If you made more than you're eligible, then your premium may be a little bit higher. If you have a late enrollment penalty, your premium may be a little higher. So let's read what it says about the costs and premiums, okay? It says your monthly premium is what you pay each month for Part B. People with higher yearly incomes may pay higher monthly premiums, as I just stated. Your yearly income is determined based off your tax return for 2 years ago. So for 2021, this would be your 2019 tax return. There's also a late enrollment penalty that could affect your Part B premium. You'll pay this if you didn't enroll in Part B when you first became eligible. So remember that, ladies and gentlemen, when you're eligible for your Part B insurance, when you turn 65, please enroll in your Part B. If you do not, you will have a late enrollment penalty like most other plans. When you need to pay the late enrollment penalty, your monthly premium can increase up to 10% of the standard premium for each 12 months period that you were eligible for your Part B but did not enroll. You'll pay this as long as you enrolled in Part B. Part B also has a deductible, and that deductible is $203, and that needs to be paid out of pocket before benefits begin, okay? Coinsurance is the percentage of cost of services that you pay out of the pocket after meeting your deductible. So whatever it says for those fees that whatever services cost after you meet your deductible, that's how much it is. So it's usually 80-20, so you have like a 20% co-payment that you have to pay, right? So let's just say you went to go get some lab tests done, and you have your copay, which is, I think the copay is what you have when you go like to the doctor, right? And that's copay. I haven't had a copay in so long, but I think I believe, if I'm accurate, the copay is okay. A copay is a set amount that you pay for services. Copays aren't typically associated. However, there's some cases where you need to pay one. So okay, let's say if you go to the doctor, I hope I'm accurate, and they have a 20% $20 copay when you walk in the door. That's how much you got to pay. And then you get the lab fee. The Medicare Part B pay 80% of that. So I'm not doing math right now, but let's say the lab costs $100. Medicare Part B pay 80% of that $100, leave you with like $20-something that you have to pay for that fee, for that lab test. You know what I mean? So I hope that made sense. So that's what your coinsurance is. That's what you have to pay after your deductible, and after everything is paid, which you have to pay your portion of the bill. An out-of-pocket maximum is limit of how much you have to pay out of pocket for cover services during the year. Original Medicare doesn't have an out-of-pocket maximum. Okay, so I'm sure there's much more. Let's see what else I can tell you about the costs. I'll be right back. Okay, lastly, this says you pay, which we've already stated, but I'll say it again. It says you pay a premium each month for Part B. Your Part B premium will automatically be deducted from your benefit payments from Social Security, rural benefits. If you don't get these benefits payments, you'll get a bill, which you can direct pay. You can pay it from your checking account, savings account, credit card. Hey, make your payment or they will cancel you. Most people will pay the standard premium amount. If your modified adjustment gross income is above a certain amount, you may pay an income-related monthly adjustment amount, which is IRMA. Medicare uses the modified adjusted gross income report on the IRS tax return for 2 years. This is the most recent tax return. And lastly, I'm just going to post this here so you guys can see what I'm looking at. It's a breakdown of how much you'll have to pay. Looking at your tax return, if your spouse, single, married, how much you'll have to pay for your premium for your Part B. So it's the first line says file individual tax return $88,000 or less. File joint tax return $176,000 or less. File married and separated tax return $88,000 or less. Your monthly premium would be $148.50. The second line is above $88,000 up to $110,000. File joint tax return above $176,000 up to $222,000. You'll pay $207.90. So I'm just going to put this here so you guys can see it. So I don't have to read it and you guys can see it for yourselves, okay? So it has a breakdown on Medicare.com. If this goes too fast, it has a breakdown on Medicare.com that you can go to and you can actually see this for yourself. What you'll be looking at if you're paying if you made this much in your income tax on your tax return, if you made $500,000 or above, individually, jointly $750,000, married $412,000, your monthly premium will be $504.90. You see what I mean? So the more money you make, the more money your premium will be. Okay, so the next question is, when can I enroll in the Medicare Part B? So I'll just read you what it says. It says some people are automatically enrolled in original Medicare, while others need to sign up. Those who are turning 65 are already getting retirement benefits from SSA or the Railroad Retirement Board. People under 65 with a disability who have been receiving disability benefits from SSA for the past 24 months. Individuals with ALS who is getting disability benefits. It's important to note that even though you were automatically enrolled, Part B is voluntary. You can choose to delay Part B if you wish. One situation where this may occur is if you're already covered by another plan through your work or spouse. So if you're still working and you still have insurance through your employer or through your spouse, you can delay this. Okay, as long as you're still covered. You will probably have to show proof that you are covered when that plan expires, that you were covered for that period of time, so they do not apply a late enrollment penalty. Okay. Who must sign up? Remember that not everyone who is eligible for original Medicare will be automatically enrolled. Some will need to sign up. Those who are turning 65 and are not currently getting retirement can sign up beginning 3 months before they turn 65. People with ESRD can sign up at any time when your coverage while begin may vary. Initial enrollment period is this is a 7-month window around your 65th birthday when you can sign up for Medicare. It begins 3 months before your birthday, including the month of your birthday, and extends 3 months after your birthday. So my birthday is January 16th. 3 months before that, October, November, December. 3 months before that I can enroll. My month of birth is January, and then February, March, April. I can enroll 3 months after. So you have a 7-month period to enroll in your Part B. Open enrollment, which we've already discussed, which starts October 15th through December 7th, ladies and gentlemen. That is the time to get on the phone and call us and get yourself enrolled for any plan. Part A, B, C, and D, that is open enrollment. You can transfer in and out of plans as often as you want until enrollment closes December 7th, okay? And general enrollment period, which is January 1st through March 31st. You can enroll in Medicare during this time frame if you didn't enroll during your initial enrollment period. Special enrollment period, if you delay Medicare enrollment for approved reason, you can later enroll during a special enrollment period. You have 8 months from the end of your coverage or the end of your employment to sign up without penalty. Okay? I hope that made sense for you guys. Okay, so before it gets pitch black, I'm trying to stay in my window. So before it gets pitch black, okay, just the last little takeaway. Once you turn 65, you have a 7-month grace period to enroll in the plan. You have 3 months before, 3 months after, including the month of your birth, to enroll in your Part B. You can enroll if you have a disability. You already have SSA benefits being given to you. You can enroll in you can be eligible for Medicare Part B. Medicare Part B also has a premium. This year it was $148 that came out of your Social Security check with a $203 deductible. Those numbers may change for the next year, so look out for that. When AEP opens, the website for Medicare.com may update, and also any we go by what Medicare says. So all insurance company premiums for their plans may increase too for the year of 2022. So keep that in mind when you're out there searching for your plan. It is your medical insurance. It covers your doctor's fees and all those things that we listed earlier. And yes, so when you're eligible, and please enroll when you're eligible to enroll late enrollment penalty, unless you're already enrolled in Medicare insurance through employer or your spouse. Okay, so I hope this helps. I'm sorry about the darkness. I try to get this out as fast as possible, and I hope this helps. Welcome to AEP. AEP is around the corner, so I wish you guys the best, and I hope to talk to plenty of you during AEP. They're welcoming you to United Healthcare. All right, see you guys in the next one, with your last video, which is Medicare Part A, which will be coming in November. Okay, have a nice night, guys. Bye.